My name is Amy Lopez. I'm a physician assistant at Palomar Emergency Room. So with the pandemic with COVID, it was kind of a roller coaster, starting with us first becoming aware of it in March. As far as we noticed more sick people were coming through the ER before March, and it seemed like we had a really bad flu, but they'd come back flu negative and we didn't know what it was. And then we got more and more information about a new respiratory virus that was going around. And first I didn't think much of it because I had already gone through the swine flu H1N1 in 2009, and that was killing young people. And so this new virus was coming out that's killing elderly. I wasn't overly concerned about it first, and then it escalated. And then it went from being an epidemic to a pandemic pretty quickly. And the number of fatalities was profound. The other thing was the prolonged period people had to be in the hospital when they would get sick. The news made the world aware, and they recommended that everybody stay indoors and only leave their house. And the isolation mandate was enforced for social distancing, and as a result, no one came to the hospital. All of a sudden, the hospital was completely empty, to the point where we would see I usually see 30 patients a day, going down to seeing 6 patients a day and being sent home early almost every shift or called off every shift, because no one was coming to the hospital. And we didn't understand why people should still be having appendicitis or heart attacks. But people are staying at home because of fear leaving the house and not knowing what to expect. We didn't have that many cases coming through the front door. The ones that were coming in were the ones sick enough to be admitted or need intubation. So we didn't have a lot of people coming through the front door at first with COVID. Most people were staying at home and heeding the warnings of the news. However, people fatigued it that quickly. And then all of a sudden, when some of the mandates were lifted, we had huge surges of COVID cases throughout all age ranges, with children doing the best by far in regards to their recovery and their severity of illness. And then we had to start having separate units to deal with the COVID influx and having to separate patients. And the first separation criteria was fever. So you'd have to go to a separate site at the emergency room for fever. And that made people very fearful. I think humans always have the ability to respond to situations in a more intelligent fashion, because it takes history as a precedence for us to know how to respond to things in the future. And we hadn't had something like this since 1918. And medicine in 1918 was far different than medicine is today. So I feel like what COVID provided us is a basis of how to deal with these situations in the future. Well, as I think most families, there was kind of a division in our population. Politics got integrally involved in the virus, and the people's expectation of how treatment should be, and the role of the government, and how much freedom or lack thereof humans should be allowed to have when something of this caliber happens to our society. So within my own personal family, I have 2 children. I'm a widow. And 6 months or so before we were quarantined, my husband had passed away. So we'd had a major loss in our family. And to be told that now, 6 months later after that loss, we weren't allowed to live our life that is obviously very precious and can be taken away from you at any time, to be told that we can't live our life and that we have to stay indoors indefinitely until we get a virus under control, with my pre-existing belief that viruses are here for a purpose and that we aren't going to be able to control a virus, compounded that with this already set of depression that I can't leave my home, and I just lost my spouse and my kids lost their dad. So for me, I wasn't one to want to quarantine. I wanted life to go on. So for me, on a personal level, COVID was far more impactful than it was as a job level. I've been an emergency room physician assistant for many, many years before this. And I had seen lots of ups and downs, and I had been through flu season after flu season. And yes, this was worse, but it wasn't, to me, it was just 2 years of the flu. It was 2 years of exhaustion and explaining myself to people who don't understand viruses. The hardest part of COVID for me was the family. And my kids losing their schooling, friends, support, and being caught in the middle of anger between adults believing in one thing and other people believing other things, and then tying that into politics. There was no reason ever for this virus and politics to come together. Like, medicine and politics should not be one and the same, because people want to believe their leader, or they want to believe this other person, and they get so wholeheartedly invested like it's their team that regardless of logic, they'll follow whatever their leader has to say. And people are like that. They follow their leader. And this whole thing of it was nobody knew anything. Nobody knew what to believe. Nobody knew the right answer. Everybody was guessing the whole time, or everybody's just guessing and using old data to try to figure out how to deal with this new virus. And so, again, the hardest part of COVID had nothing to do with the medicine, because the medicine was, it's a virus. Your body will fight it. It won't fight it. You will live or you will die. And it's not really up to us as healthcare providers to decide if that's going to happen for you. When a virus hits you, it's your body's decision if you're going to live or die. And we have medications and vaccines and other things to help augment it, but ultimately, it's your immune system that decides. But the social aspect of it, I think, was the hardest for me. I think that you should get vaccinated. The benefits of the vaccine far exceed the potential consequences of the vaccine. Yes, people can have reactions to the vaccination. People can have long-term permanent neurological damage from vaccines, any vaccine. That's true. But a lot of people have different things that are considered conspiracy theories when it comes to vaccinations that have no basis in reality. It doesn't mean you're not going to get the virus, but when you do get it, you're going to be able to fight it a lot better. And I do believe that you help save the lives of those around you by having a stronger immune system. And that's what vaccinations allow you. They allow you to be a stronger human being. Essential healthcare workers are absolutely that. We are essential. And I do hope that more people choose to go into medicine. We have an extreme healthcare shortage with regards to nurses. It's a very rewarding line of work, and it allows you to give back to your community.